You are just there. When it starts giving you the symptoms, then it's too late. Start checking yourself. Even when you are normal, you be checking so that you can see it early and then treat it. The earlier you treat it, the better the outcome is. When it gets to the latter stages, you have bleeding and abnormal vaginal discharge. How do you prevent it? You have your normal cervix. Avoid infection. How do you think you can avoid the human papilloma virus infection? How can you avoid it? So no sex. So if you don't have sex, it means you can't get the human papilloma virus. Right? Good. So if you have not had sex and your partner too has not had sex and you marry and you are in that line, you don't have a problem. Do you understand it? It's when you go and get it from somewhere and you keep it. And the sad thing is that you get it early on in life. Okay? You have a young lady, she starts sexual intercourse maybe from 16, 18, 20. Today she has one boyfriend, tomorrow she has another one. And then she decides to stop and come to Rulers of Zion. Now she's moving. But the thing is there, it's hiding in her. And it's going to show up later on. So you need to actually start avoiding right from the beginning. Okay? That's very important. Or we can give immunization against the human papilloma virus. It is coming up now. But it's not very common yet. It's a bit expensive. And then you screen looking for, if maybe you didn't avoid it and you have it already, you have to be screening so that when the changes occur, we can see them early and treat them before they become cancer. Okay. So what is how do we screen for it? We use what we call pap smear test. There's another one called liquid-based cytology where we take some cells from your cervix and then look at them to see whether they are becoming cancer. Okay. So who needs a pap smear test? Basically, almost every woman will need a pap smear test at some point in her life. As long as you become sexually active at some point, or you are 20 years and above, you need to check so that you can know whether you are getting it or not. It should be done at least every 1 to 2 years. If after 30 you have had normal pap smears all along, then after 30 you can stretch it to 3 to 5 years. And then when you get to 70 and you are still alive, you stop. All right, because once it's been normal, you are not likely to need it again. Some new things that are coming up is that we are now able to test for the HPV, that virus. We're able to test for it. And so we can actually test for it and know whether you have it, and then we can treat you earlier than with the pap smear. There's also something called VIA. This they do usually at Ridge Hospital and some other places. It's cheaper than the pap smear, where they look at your cervix, put some chemical on it, and it shows whether there are changes. They can treat you immediately. And this is the vaccination, which can be given to girls aged 9 to 12, so that it prevents them from getting the human papilloma virus, even if they are exposed to it. So this is something studied. So, mummies, your daughters aged 9 to 12, you are getting that for them, isn't it? All right. How do you prevent? Delay initiation of sexual intercourse. Don't start sex early. Wait until marriage. Wait, because the earlier you get the HPV, the more likely it is to become cancer of the cervix. Once you are married or once you have a sexual partner, remain faithful to that partner so that you do not get new infections. You can also use condoms to prevent HPV infection. So this is the way to prevent. How do you treat cancer of the cervix? Cancer of the cervix is treated basically by surgery to remove that section so that it does not spread. And then we also have something called radiotherapy, where they use some special X-rays into your body to kill the cells at that point. Breast cancer. Breast cancer is the commonest cancer of women in this country. How many of you know somebody who has breast cancer? You know somebody. You know somebody. You know somebody. You know somebody. Do you see what's happening? So it means it's quite common, isn't it? More than the cervical cancer. It's very common. Please, you don't have to be old to have breast cancer. You can be your late 30s. You can have breast cancer. That's why I brought these pictures. Okay, so that you can see younger people. All right. Breast cancer is more common in developed countries than in our system. But as we are changing, now we are changing, isn't it? Our diet is changing. The kind of things we are eating is changing. So many things about us are changing. And so slowly we are becoming more and more like the people who have more breast cancer. Who can get breast cancer? Any woman can get breast cancer. In fact, even a man can get breast cancer. Men, do you have breasts? Do men have breasts? Yes or no? Somebody say no, somebody say yes. Do we or we don't? Men don't have breasts. Hey. Men have breasts. Look, I'll let somebody remove his shirt now and show us. Men also have breasts, but the breast is much smaller. It doesn't have fatty tissue, isn't it? It's much smaller. So breast cancer in men is more dangerous because as soon as it comes, it starts spreading. So men should also be aware, but men don't get it as frequently as women. Women get it more frequently. Everybody is at risk. So don't say that as for me, I'm not at risk. You may also have it. Let us look quickly at survival of breast cancer. When you have breast cancer, high chance of dying. In advanced countries, 70 to 90% of women who have been diagnosed with breast cancer will survive. In Ghana, when they diagnose you as breast cancer, 25% will survive, 75% will die. Why the difference? Why the difference? The cost of treatment is high. Okay, but that's not the answer. But you are right. Late diagnosis. Late diagnosis. You check, you feel something. And I'll teach you something today. You feel the thing, then you say, it's not cancer in the name of Jesus. But the thing is there. And then you don't touch that place again. Then you wait after 2 months. So 3 months have passed. Okay? Then now you take it to Our Lady. And then she said, let us deliver you from this demon of breast cancer. And then they pray for you for another 3 months. Now the thing is starting to grow. Now everybody can see. Isn't it? Now you come to the hospital. It is late diagnosis by 6 months. How do you think you survive? You survive, you die. No, that's the problem. I want to tell you so that you know. And then you are free. Please, when you see her, the first thing she'll tell you is that go to the hospital. So listen to her advice. I've had so many people, they come. You diagnose breast cancer. You tell them the treatment, then they disappear. They go for a number of months, then they come back. Now the thing has grown bigger. When it is very small, it is more easy to treat and you are less likely to die. But when it is much bigger, then you are treating and nothing is happening, you are still going. So delayed treatment is one of the problems. Delay in presentation. Also, unfortunately, in Ghana especially, we have a type of breast cancer that is very aggressive. You even see it early, you are treating it and still the thing is not going. I don't know what it is with Ghanaians, but it's amongst us. We have it. Triple negative breast cancer. And it's known to be in Ghana. So you have it and it spreads very quickly. You see the small thing, if you don't take action immediately, it's just going to spread and that's your end. So these are the two reasons why in Ghana we have a low survival rate. So we need to be able to get to the hospital earlier and find out what we have so that the treatment can be started immediately. Breast cancer treatment is almost like an emergency. As soon as you get there, you have to be treated, diagnosed and treated appropriately. We don't wait. Who gets breast cancer? Increased chance. The older you are, the higher your chance. But please, we have people in their 30s who have breast cancer. If you have had somebody in your family with breast cancer, then you're at risk. You should even be more concerned for yourself. Smoking and alcohol. If you have a lot of fat in your diet or your body weight is more, then you're more likely to get breast cancer. Those who have children are protected. If you don't have any children, then you're at higher risk of breast cancer. The more children you have, the lower your risk. If you are breastfeeding also, those who breastfeed for longer periods of time also have less chance of having breast cancer. Okay. How does breast cancer look like? Breast cancer is not painful. It is a little lump in your breast or in the armpit. Sitting there, not painful. Sometimes the skin may change a little bit. Sometimes there may be some discharge. That is how it looks like. So here you have it, a small lump. Maybe the skin has changed a bit, or the texture of your skin is changing color. Your nipple looks like it has been pulled in. You know, when you stand, whether a man or woman, your nipples are pointing in a particular direction, isn't it? All right. When you know that the direction has changed, your direction, and now one is doing like this or like this, it means there's a problem. I hope you understand what I'm saying. Okay, that is a change of direction. If you have blood coming from the nipple, it's a sign of breast cancer. Blood is not always red. Blood can be green, can be black, can be brown. So if you see any of these discharges, then you have to take note that there may be a problem. This is how it looks like when it has advanced so far. This is a different type of breast cancer. But most of the time, your breast actually still looks normal as it is. So prevention of breast cancer hinges on you. Now, the breast, who is it for? Your breast is for you, isn't it? It's in front of you. Is it at your back? Can you easily touch it? Yes, so it is for you. So you are the one supposed to screen for it. Okay? So that is the first thing we do. Breast cancer examination by yourself. The next thing we do is mammogram, which you do after 40. Where they put, I'll show you that one. And then a breast ultrasound scan. So I'll show you how to do your breast examination. Will somebody come for demonstration? One volunteer. Let's clap for her. Let's clap for her. Of her hand. Okay. She's using this part of her hand. She's not using the tips here. Right? She's using here. Are you getting it? All right? She's not going to do like this. She's not eating banku. She's going to use the flat of her hand. Okay? Now, she's going to use this hand, which is her right hand, to check her left breast. Right? And she's going to use her other hand to check her right breast. Her left hand to check her right, and her right to check her left. All right? All right, so she's not going to do that here though, but at home, she's going to take off her clothes and stand in front of the mirror. And then what do? You look at yourself, isn't it? Yes, and then she looks at the skin, the texture, the shape. Is there anything changing the shape, like what we have talked about? Okay? And then she's going to lie down flat on her bed. Okay? So let's assume she's lying on her bed now. All right? Then what she'll do, she'll take her hand and press her breast between her hand and her chest. What do you feel, madam?
I feel some pains.
Hey.
Yeah.
Oh, don't press so hard.
Oh, okay.
Just gently. What do you feel now?
I don't feel anything.
Nothing. Okay. Okay, that's it. You don't feel anything. Okay, so she puts her hand on the breast tissue and moves the breast tissue a little bit over the chest. Okay? Not rubbing it on your chest. No. She presses on the tissue and moves the tissue. Okay? Then she goes to the next section and does the same thing. Men, are you doing it? Women, let's do it. Everybody should be doing it. She goes to the next section. Please, are you getting it? Right? She goes to the next section. Okay, and slowly goes round all her breasts. Some people can do it in 1 minute because their breast is not plenty. Others will take 10 minutes because they have more. So you do what you have to do. All right? Then it goes to the middle part. Because you are covering every part, right? That's how you're going. All right? So you've covered every part now. All right? Now, go this way to the side here. The breast continues at the side here. All right? So she's going to check that place as well. You get it on the side. Everybody do the side. Let's see. The side. 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 You are still doing front as same. Then the last part he's going to do is inside the armpit. Right up in the armpit. Okay? Are you okay? Right? She's doing it that way. All right? So in this way, she has checked every part. She's gone around the whole breast, the outside, and all the way inside to around the nipple. She's done the side, and she's done inside the armpit. Okay? Then you put that hand down, and then you're going to go to this side as well. Do the same thing. Okay, I hope this is clear. All right, let's give her a round of applause. Thank you, madam. So she's going to go around like that, using her fingertips to do that. Anytime you do with your fingers like this, you feel a lump. That's not what we are looking for. That's why your hand must be flat. Okay? Otherwise, you feel a lump. What are you looking for whilst you are doing this? A lump, okay? A lump? What are you looking for? Yeah, you also say some. A lump. What you are looking for is to know how your breast normally is like. That's what you're looking for. How is your breast like normally? That's what you want to become an expert in. You must be an expert in your own breast. That as for me, this is what is normal for me. So you check and then you know that this is how it is. So that when there is a change of any sort that happens in your breast, immediately you report to the hospital. Do you understand? When I say look for a lump, you may not even know what a lump is. But when you check all the time and it is normal, you get to know what your breast normally is. When there is a change, you notice it immediately. And that is why you must start early on in life. Your age now is fine. You check at least once a month. Make it your habit that you'll be checking. And then at the end of the time, when a change appears, you yourself will notice it. And then you come to the hospital for us to check. Okay, so we're saying that do that every day, once a month, every year. Then once a year, come to the hospital and let the health professional check your breast. Check it and say, yes, it is normal. Okay? After the age of 40, you still continue your breast exam. You don't stop. But we want to add the mammogram. The mammogram is a machine. Like that. Yeah? And you put your breast on a flat thing like that, like a tray, and they take an X-ray of your breast. Okay? So that they can see things that are so tiny that your hand cannot feel it. So after 40, everyone should have a mammogram. How many here have had a mammogram before? 1. Okay, so 1 out of 3. The rest of you are not eligible. 1 out of 3. Okay? That's 30%. That's too low, isn't it? Yes. Yes. At least every 1 to 3 years. Especially as a Ghanaian woman, because you have a type of breast cancer that can grow very, very fast. And so we need to do it. But I think they don't like doing mammogram, isn't it? Why?
I believe it's the cost. And sometimes to People are afraid of the results.
Okay, the cost is usually not that high. Mammograms range from 40 to 120 Ghana cedis, which I don't think is too much of a problem if you have to do it once a year. Let us assume it is 120. That means that every month you put aside 10 cedis for your mammogram. Then at the end of the year, you go and do it. Is that too expensive? Well, our mommy there told us that the treatment of breast cancer is very expensive, isn't it? So let us spend a little bit on prevention and we'll be fine. Okay? And the other thing is that they don't want to know the result. But why don't you want to know the result? You prefer to die rather than next year. You should know. Sorry? It's fear. Yeah, but you should know what is happening so that you can get some solution for it. It even helps you in your prayer direction. You know how to pray, isn't it? Okay. There are some lifestyle interventions that can be done to reduce breast cancer risk. Eating more fruits and vegetables a day. This can be a problem because generally we don't eat a lot of fruits and vegetables in Ghana. We don't do a lot. But eating more fruits and vegetables helps to reduce the risk of getting cancer. Regular physical activity is also very important to do that. Aiming for a healthy weight. I must say that we have a weight problem in our country. Once people pass 30, 35, our weight is all going to overweight and obese. And I think it's because of our lifestyle. Alcohol intake and smoke also increases the risk of breast cancer. The treatment for breast cancer is surgery or chemotherapy or radiotherapy in certain combinations as deemed to be fit to your diagnosis. So the more advanced it is, the more different kinds of treatments that you need to have. You know, people are afraid that they are going to take off the breast, isn't it? But now there are other ways that breast cancer can be treated, especially if it's very small. If it's very small, they can just take off a part of it and your breast still looks the same. But if you wait too long, then it becomes a bigger problem. Okay? So early treatment is important. Okay, let's briefly talk about uterine fibroids. Because this is common. How many of you know somebody with uterine fibroids? Fibroid. Have you heard of anybody with fibroid before? Let's see by hands. So you see that now the hands are becoming more. When we started cervical cancer, there were few. All right, let's call it fibroids. It's actually called uterine fibroids, but if you want to call it just fibroids, that's fine. That's fine. So fibroids is also a problem. In fact, it's much more common than cancer. Okay? But whereas cancer will surely kill you, fibroids will not necessarily kill you. They cause more problems for you and other issues. I'm going through a little briskly so that we can have some time for questions very soon. All right. What do fibroids do? Fibroids are actually some growths inside the womb. They grow inside the womb and they become a bit big. They are not like cancer, which will spread to other parts of the body. They will stay in the womb. Okay? They will grow in the womb and cause certain problems in the womb. What are some of the problems? You may have heavy bleeding. Maybe you notice that your bleeding was usually maybe 4 days. You change 2 parts during the day, 1 at night, which is normal. And then suddenly now you're changing about 5 a day. And at night you have to wake up 2 or 3 times to change. And even that, by the time you wake up, there's blood on your bed sheet. Then you know that you are bleeding too much. So fibroids can make you bleed too much. If you realize that you have to change your pad every 1 to 2 hours, it means you are bleeding too much. Some people are bleeding a lot. They have put 2 pads and 1 pampers. And they say, oh, they are okay. But it's telling you that there is a problem. It's just that you have adapted to the problem. So heavy bleeding can be a problem. One sign of heavy bleeding is also clots in your menstrual blood. If you have blood clots in there, it is telling you that your bleeding is a little too heavy. Some people get their belly becoming bigger. The fibroids can become so big that the tummy gets big. Okay? That may be another sign of uterine fibroids. Sometimes the fibroids can cause problems with getting pregnant or maintaining a pregnancy. So they get frequent miscarriages, or they're not getting pregnant at all. So sometimes that's what the fibroids do. Sometimes because of the symptoms, people get very sad and very depressed because they're having these problems. Some people also get frequent urination. Every few minutes they have to go and urinate. That may be because the fibroid is sitting on the bladder. And that may be causing a problem. Some people also have severe pain, either during their periods or even if it's not their period, they still have pain. This may all be due to fibroids. So these are some of the symptoms of fibroids. So if you have any of these symptoms, you need to go to the hospital and let them check what really is going on with you. How do they look like? This is a nice picture of fibroids in the womb. Okay? They are growths. This section here is a normal type of muscle you have, this area, okay? It has been cut open for you to see. And then these are the fibroids. Do you see these round things? Those are the fibroids sitting in there. There's even a big one on the outside here. That is how they look like. They can grow to any size. They can grow to any size. I've seen one where the stomach was just looking big like a pregnant woman. They just grow like that. And then they start causing the problems. They cause different problems depending on where they are in terms of location. Some of them are located inside the muscle, like this one. Okay? So it doesn't go towards the outside, it doesn't go towards the inside. It's just sitting in the muscle there. Those ones may not give you any problems. Okay? But as they grow bigger, they may now start tending towards the inside of the womb. When they start growing towards this side here, then you are going to have more bleeding during your menstruation. You're going to have problems getting pregnant. You're going to have problems with maintaining a pregnancy. Sometimes they're actually growing as a polyp hanging inside the cavity. These ones are very painful, and they also cause a lot of bleeding during menstruation. Sometimes they are growing towards the outside of the womb. When they are growing towards the outside of the womb, they usually don't give any problems. And so these ones can grow very big before you actually notice them. Some of them may be attached to the uterus by a small neck like this. And then you have a big fibroid there. And so sometimes they can twist on themselves and become very painful. The reality is that most people have a combination of these. So they have a number of them that are together. Not usually one. A few people have just one fibroid. But most people have multiple fibroids. I've moved more than 100 fibroids from one person before. Some of them 60, some 30. The most recent one I did was 33 fibroids. Do you see what is happening? There may be many of them all over. Sometimes you just get a few, maybe 5 or 6. But they're usually multiple. So that's how they look like. What is the treatment for uterine fibroids? You only treat fibroids when they are causing problems for you. If they are giving you symptoms like we mentioned and they are bothersome to you, then we'll treat them. So we may treat the symptoms of the fibroids. We may give you some medication which can temporarily shrink the fibroids depending on your age. Maybe if you are 45 plus and you have fibroids, they are not too large, they are giving problems. We can give you some medication which will temporarily shrink the fibroid and then waiting for you to get to menopause, because after menopause, the fibroids will all shrink. The mainstay of treatment, however, for uterine fibroids is surgery to remove them from the womb so that your womb becomes normal again. Prevention of fibroids is also eating healthy, having a healthy diet. I think you talked about diet, isn't it? Having a healthy diet. It's not just to look good, but it's actually to prevent. You know, we talk about breast cancer prevention. Same thing, isn't it? Fibroid prevention, same thing. having adequate exercise, and maintaining an ideal body weight will all reduce your risk of getting having your fibers growing fast. Okay, let's briefly go through vaginal health and fertility, and then I'll open the floor for questions. Vaginal health is very important. The way the vagina functions is dependent on what stage of life you are in. A newborn baby has the estrogen of the mother, and so the vaginal health is like that of the mother. After a few days of neonatal life, when you are born, after a few days, maybe by a week or two, it becomes back to the normal system of a child. So a prepubertal child, that's a child before puberty, maybe from 0 to 9, 10, 11, is a prepubertal child. They have very low estrogen level. So they don't have very good protection of the cells in the vagina. So they get frequent infections. So you see that the little girls sometimes have an offensive discharge. They will have some discharge which is in their panty and so on, because they don't have a lot of estrogen. Then by the time you get to reproductive age, from your first period onwards all the way to the end of reproductive life, about 45, 48, that is when you have your normal vaginal health. And I'll describe that in a minute. Then after menopause, you start having less estrogen again, and because of that, you are more prone to having some bleeding and some discharges and so on. Let me describe what the normal is. A normal vaginal discharge in a woman who has had her first period and is in the reproductive age is that the discharge comes in different quantities. Everybody has a different quantity, but there is always some kind of discharge from the vagina. The vagina is not dry. There's always some amount of discharge, depending on the time of the cycle you are in. During your menstruation, what comes out? Blood. Okay, the women are answering, the men are quiet, because they don't know what is happening. So you have blood coming. After the blood, you have a small discharge, which is usually brownish, isn't it? And changes to a little creamish to whitish, isn't it? That will be there for a few days. And then when it gets to around ovulation, you have much more discharge coming, which is more sticky. It's a bit like okra, isn't it? You touch it and it's like okra. Then you know that that is around ovulation. And sometimes it's so much that you actually need to wear a panty liner. Then after that, a few days later, it will stop. And then you have a whitish discharge again coming all the way until you get to your period again. That is normal. This type of discharge does not itch, does not have a bad odor, and is not of excessive quantity. Okay? When you see this type of discharge, don't go and start treating yourself for anything, because you're not sick. And that's the biggest problem we have. They start having this whitish discharge, they say, oh, we have a problem. But you don't have a problem, because that is the normal. Okay? What is abnormal? Abnormal is when it starts to itch, or you have a burning sensation, or the smell is not the normal smell, or the quantity has become so much that it becomes a problem for you. So keeping healthy, don't treat yourself for any vaginal discharge. If you think you have an infection or a problem, come to the hospital, let's check, so that you don't have unnecessary treatment. Because the more unnecessary treatment you have, then the worse your problem becomes. Okay? Wash yourself normally with your normal bathing water, your normal bathing soap. You don't need to use any special soap. Wash down, wash in between the folds, keep the place clean. Make sure when you are washing from the front towards the back, so you don't have the bacteria from the anal side coming to the front. It's the same if you are using a washroom and you're using T-roll to clean. You clean from the front towards the back, never from the back towards the front. Okay? So that is about how you must keep healthy. Okay, I think my time is up now. Last thing is about your fertility, which I think you also wanted me to talk about. So fertility, I believe that most women at some point in their life dream about this, isn't it? Some, or most. Let's say most. What about the men? Yes. Somebody says yes. But some are not too sure. Some are even scared. All right. So let me give you just 2 slides on the fertility, then I'll open the floor for questions because time is up now. First thing is that your fertility is very important. Your fertility is important. Sometimes you don't understand the importance, and therefore you do so many things to destroy your fertility. 2, the reproductive system, especially of the female, is very delicate. Very, very delicate. Any small infection and that's it, is spoiled. The tube is a very fine little thing. When you have any infection from a sexually transmitted infection, that is it. So we need to keep ourselves very carefully. Your past and present sexual habits affect your future fertility. Abortions can affect your fertility. Sexually transmitted infections can affect your fertility. And so you want to be very careful not to get some of these things. The causes of infertility can be either from the man or from the woman. Almost 50% are from the man, almost 50% are from the woman. So when there's a couple and they're not getting a pregnancy, don't always look at the woman. Start looking at the man also, because he may also have a problem. Now these are 6 myths which I want to talk about. These are all untrue, okay? Contraception can cause infertility. It's not true. Contraception can actually enhance your fertility by avoiding unnecessary pregnancy and avoiding sexually transmitted infection. Vaginal discharge causes infertility. It is not true. Unless the vaginal discharge is of the abnormal type that I talked about, then it can be an infection and therefore can affect your fertility. But if it's the normal discharge, you don't have a problem. The 3rd point, the best way to test for fertility is to get pregnant. It's not true. Because if you are not ready for a pregnancy and you get pregnant, what will you do? Abortion. And that itself can cause more problems for you. Infertility is usually the woman's fault. We know that is not true. My stable partner is safe from sexually transmitted infection. It is not true. Your partner who says you are his only sweetheart may be telling the truth, but maybe only for a while. And he may still bring a sexually transmitted infection home. So you need to be very careful. One cannot get pregnant the first time is also not true. You can have sex the first time and you can get pregnant the first time. And I've seen it all the time. And they just don't understand why they got pregnant. Okay. So I think that this will be the end here. Let me leave the... Let me open the floor now for questions so that I can answer a few questions before we go. Yes. Are there any questions? Yes, so first question, please.
Hello. Sir.
Yes, go ahead.
We hear about infections by name, gonorrhea, chlamydia, and stuffs like that. Who can have it, and what causes one to have? Because you were talking about vaginal discharge, and I believe it has something to do with vaginal discharge. Who can have it, and what causes one to have it?
Gonorrhea and chlamydia are sexually transmitted infections. They are transmitted from one partner to another. They are little organisms or bacteria. So they are transmitted from the male to the female, and then they go and infect your system and cause a lot of problems in your system. So if your partner has it, then you are also likely to get it. The more partners your partner has, the more likely you are going to get it. The more partners you have, the more likely you will get it. Okay? So the only way you can avoid it is through abstinence, no sex at all, or 2, using a condom which has some good protection but not 100%, and 3, keeping a faithful partner. That's why the Bible says you should marry one and stay with that one, and then you don't have some of these infections. Thank you.
Sir, please, I have 4 questions.
4 questions. That's right.
Shall I ask all?
Yes, ask all.
Okay. Please, the first one, the cavinar cancer or whatever you say.
Go ahead, go ahead.
Cervical,
People
yes.
speak.
You said the use of condoms. Some condoms they have chemicals on it. Won't that one also affect the ladies on their VJ?
Yes, the condoms are used to prevent pregnancy and to prevent sexually transmitted infections. They are very effective, but they're not 100% effective. So we use them, we have to use them very well, use them for each intercourse and use them properly and dispose of them properly. And the other point is that the chemicals on the condom are usually lubricants, which are used to facilitate the putting on of the condom and the intercourse as well. Some of them also have spermicides, which kill the sperm to make them a bit more effective. Some people are allergic to these chemicals or even to the condom itself. So if you have that problem, then you don't use them.
And the second one is, you said when you are affected with those diseases, we should attend to the hospital. Some some diseases or like these sicknesses are not 100% from the body. They can be spiritual. So that one, so how are we to take that?
Can you give an example?
Okay, for example, some of the HIV/AIDS and this cancer, normally they don't come from the body. They throw it to human beings.
No, HIV/AIDS is always caused by the HIV virus.
Yeah.
Nobody throws it at you. You go for it yourself. You get it through sex. You get it through unsafe practices, which cause your blood to be joined with another person's blood or body fluids. So once you engage in any of these practices, you are going to have the virus infected. And it's no more a spiritual matter. Now becomes a physical matter. But you may have got it because you contravened a spiritual principle. And so you've got a physical disease. Do you remember that in the Bible, they talked about the diseases that afflicted them in Egypt? Okay? Those diseases. Why do you think they were getting those diseases? Because of some practices, some things they were doing. So when he brought them out, he told them that do not follow so and so practices that you had in that place. But now, this is how you must do things. He was giving you the physical formula for a spiritual something. And telling you that if you do it this way, you will not contract any of these sexually transmitted diseases. But if you go contrary to my way, you get them. So let's understand the thing about spiritual and then health-wise. Okay? The principles are there that you should abstain until marriage. But you don't want to. And then you get HIV/AIDS and you say it's a spiritual thing. It's not a spiritual thing. It's you yourself who have done it. You have got it. But it is spiritual in the sense that you contravene the spiritual principle. And you have got a physical ailment. Please go and treat it physically because it will not go. You will be praying and God is not going to take it away from you.
Sir, please, the third one. Most of us, the youth, let me say 10 years to 15 years, sometimes like there's a whitish fluid that comes out from the guys. If you press your breast, some whitish. Is that also a symptoms of this in cancer?
No. As I was saying that if you have a discharge from the nipple, it must be blood or blood-like. I said red, green, brown, or black. If it is white, the normal breast discharge is whitish or sometimes a little bit yellowish, but generally whitish. So if you have that, you shouldn't have a problem.
Okay. My last question.
Your last question, your fourth question.
Please, reason why most people don't check, like they don't go for check or anything, I think it's because if they get to know their results, they become depressed and also lose concentration and just kill themselves. Yeah. So thank you very much.
Yeah, the last question is very interesting and very important. When you don't know something, you think that you are safe, but you are not safe. It's better to know it and then address it so that you'll be healed and you'll be okay. It is good to know what is wrong so that a treatment can be given to you. Yes, you may get depression, you may become sad, you may even want to kill yourself. That is why we also have psychologists and counselors. They will counsel you. Sometimes you tell somebody that, madam, you have fibroids. She cannot understand why she has it. You send her to the counselor will take her through so many things, and then you come to terms with it, and then you are able to address it. Mind you that health is your physical well-being, it's your mental well-being, and your social well-being. Not only your physical, in your body, but what is in your mind is also your health. And what is in your social sphere is also your health. So health is defined as these three things together. Then you are healthy. So the fact that you have a physical condition that you have diagnosed and you become depressed is still an ill health. So take your depression to the appropriate person to help you to deal with it and to address it. So very good question. Thank you very much. I think I'll take one more question and then
Doctor,
two
please,
more.
I want
Okay.
to ask if you put Dettol in water to bath, and then you use the water to wash the vagina. I want to ask if it will give you any infection.
Your normal water that you use to bath, whatever water you want to use to bath your whole body, use that same water to bath the vaginal area. You don't need to do anything so special.
So putting the Dettol into the
Some
water.
people put Dettol in water because the source of their water is not clean, and Dettol would help to disinfect your water. So if that's what you're using to bath generally, go ahead and use it to clean your vaginal area. That's what I want to say. That whatever water you're using to bath, use that same one.
Finally, please, what causes fibroid?
Fibers are already in your system when you are born as a genetic something. And then as you grow and your reproductive system starts to get kicking around your puberty, then the fibers also start growing. If you have those factors that I mentioned earlier, poor diet, your no exercise and so on, then they are even growing faster. So people are usually born with that. They are there already, and then they grow over time. They are born with the ability to grow fibroids. Okay? And it runs in families. You see that if the mother has it, the daughter is likely to have it, and the sister is likely to have it, and so on. So you can see it's a genetic something that is running in. But it will not start showing symptoms until they start growing after puberty.
When you are saying, I have to ask two questions. One is that how the doctors treat cancer in Ghana or in general about this chemotherapy. I want to ask them, but one thing I get to know, when they put you in the chemotherapy, all your cells die. I want you to explain how did you treat about that? And secondly, you say about this cancer in Ghana, some cancers, survivor cancers are just spreading. Within, you can see it within some few distance, it just spread. And you say it's in Ghana. So my brother was saying something that about that. And he said in Ghana, I can say that one is spirituality. That's what that is verified. Because other nations, when you go developed countries, is not specified like Ghana. Only Ghana and all this is course. So that's why I'm asking, like how my brother was saying. And the chemo is important to me because I see this in South Africa when they put the person in chemo. Later on, all the cells in the body die, and there also there's a lot of implications. So I want you to explain them so that I can hear about the chemo treatment, about the chemotherapies.
Okay. You see, sometimes we need to see the whole picture. When you have cancer, that cancer is going to kill you. Okay? That cancer that you have is going to continue to grow and spread all over your body. So you have to kill the cancer first. Before the cancer kills you, you have to kill it first. So one, you must diagnose it when it is very tiny. Not when it is big. When it is big, then you are fighting a losing battle. When it is very tiny, then we treat you. We can remove the cancer, we can give you chemotherapy. The chemotherapy will kill the cancer cells and the normal cells. Okay? They kill both. But the normal cells are able to recover faster than the cancer cells. The normal cells, I'm sorry?
You are saying it's in your blood. Somebody can go somewhere and go and just have intercourse and bring it. It's in your blood. And if you look at picture that you just show us into your computer, it's in the blood and it's spread. And the blood also going circulation to the body. So there is my problem now. I want you to explain how come when they remove it, still the other part is gone and you are cured. And that is my problem. I want you to explain that to me about this chemotherapy.
So the cancer spreads different ways. It can spread directly from one body to the next, or it can enter your blood system and spread enter another part of your system which drains your fluid, and then it can also spread that way. So the idea of the chemotherapy is to give the chemical to your whole body. It kills all cells, okay? But mind you that your body cells are more than the cancer cells at the beginning. So as it's killing some of your cells, it's also killing the cancer cells. Your body will recover quickly. The cancer cells will not be able to recover as quickly. And then you treat them again. That's why they are in cycles. You treat once, then give some rest, then give more, then you give some rest. During the rest time, your body is recovering. The cancer cells cannot recover well. Then you give them another dose. So if the cancer cells are not too many, you are able to kill off all the cancer cells and leave most of your body cells intact, and your body will regenerate itself. Now, cancer is not necessarily spread from blood to blood, one person's blood to another person's blood. That's for infections. But when it comes to cancer, it's inside your body. So if it is from the cervix, then it can spread to your brain through your blood. Okay? The cells of the cancer enter your blood, and your blood is circulating anywhere, so it can pick a place and sit there and start growing at that place as well. But you don't want to get to that point. But when you get to that point, your treatment is almost likely to fail. You want to have it at the early stage where it has not spread at all. And that is the idea of screening. The problem we have in this part of the world is that we don't like early diagnosis. And when we see it early, we don't take action. So it becomes very severe before we are able to start treating it. And when you start treating something that's more severe, you will not succeed. You want to start treating it when it's very early. And then we are going to have the success of it. The reason why the success rate is, as you said, is not a spiritual reason. It's because we are refusing to say that, yes, it is there, and so let us treat it. But you watch, if we say that we are treating it early, the success rate will start going up. Yeah. Okay, I think one more question and then. A book for every.
At what age one is forgetting breast cancer? At what age?
No, you can have it. You can have it. Yeah. Yes, you can use your normal bathing soap to wash the vaginal area.
Because somebody was telling me, I think she's a medical officer. She said we shouldn't use soap.
So what does she want you to use? Water
That's
alone?
why I'm asking. So since then I've been thinking over it.
No, you can use soap. You can use normal soap. Yes.
How we wash our vagina. Some people put their hand inside the vagina and some people wash it in the surface. Which one is the best?
Just the surface is enough. The surface in between the folds and what you can see outside. That is all you need to wash. You need to put your hand in and wash more. Because then you're washing out the normal bacteria that keep the place healthy. I've written about it in the book that we've given you. So you can read about it and understand. Don't wash out the bacteria. Just wash the outside, wash between the folds, what you can see, dry it, and you are okay. All right. I think we have to end now because time is gone. And
Any of us here would want to come do a pap smear or a mammogram or whatever, what are the charges and where can it be located? Because I believe once we've been educated, we have to follow up with a kind of thing. What do we do? How do we get in contact with you? Because I don't think it would be right for us to go do it elsewhere when he's come to teach. So what do we do? How much are the charges? What's the procedure? I learned it's very, very painful. I learned one of it is very painful. I don't know if it's a mammogram or... I can tell that the lady examining her breast won't be that painful, but something to do with the vagina and the pap smear. The pap smear, yes, because I've done one before. I know that one is very, very painful. Why is it painful? I did that a couple of years ago and I haven't done it.
Okay. Interesting question. We are at Sinel Specialist Hospital, Community 10 Junction in Tema, on the main hospital road. As you drive down the main hospital road, after the first two traffic lights, you see Latter-day Saints on your right-hand side, and then the next turning on the right is our hospital. You cannot miss it. Our website is there, sinelspecialisthospital.com. I'll give you my telephone number also. If you need any help as regards to women's health, breast care, pediatric help, MRI scans, and so on, you can come to Sinel Hospital. We have a psychologist also. We have a nutritionist, dietitian who is there also. We solve all your problems. All the things we've talked about, we solve them for you. So you come in, and then we will assess you and then tell you what you need to do. So we are very easy to find, and we can address your women's health issue. Costs for pap smear, so far pap smear costs, I think, 150 Ghana cedis. And then it's too small for you. It's too much, eh? Mammograms, I think, cost 80. We don't have a mammogram at Sinel, but mammograms are generally about 80 to 120 cedis. So both of them are affordable if you think about the fact that you are doing it every year, 1 to 3 years. So it's fine. Talking about pain.
Why is it so painful?
Now, people say pap smears are painful. When you ask my patients whether pap smears are painful, they'll tell you no. So I don't know why you are saying that the pap smear is painful.
Have you heard it before? Because
yes, they are always saying, when I tell them we should do a pap smear, they are hesitant because of pain. They have done it before and they've had pain. And I say, you come. Here, our pap smear is not painful. We do it for them. We finish. They say, so have you already finished? I didn't feel anything. So I don't know why some are complaining it is painful. But I think for most of the time, we're able to do it in a way that is not painful. Most people are able to tolerate it nicely. We don't have any pain. We are not cutting anything. We just put a smooth instrument into the vagina. It shows us your cervix. We wipe off some cells from the surface of the cervix, and that's it. Within a few seconds, we are done. And it is not supposed to be painful. Uncomfortable, yes, but not a painful test. Most women are able to have it without pain. So, that is it. Okay.
If somebody should have a pain on the shoulder, would it be would it be connected with a breast cancer or a breast pain?
Breast cancer is not starting with pain. I don't want you to start thinking that if you don't have pain, you don't have cancer. Breast cancer is painless. When it gets painful, that's your end. Because then it has spread to so many places. It is not painful, and that is the problem. You don't feel any pain. And that's why you have to check yourself once a month, and once a year in the hospital, because you don't feel any pain. Once you start having pain, it means that the disease has advanced beyond so many things. You still need treatment, though. Now, people get pain on their neck from breasts if the breasts are very heavy. So those who have larger breasts, because of the bra that they wear, it puts a lot of pressure on their shoulders and neck. And they are the ones that will have pain. But if your breasts are not very large, you're not likely to get pain in your neck because of your breast. Okay. Thank you so much for your attention.
Hallelujah. What do you say to Dr. McCarthy? I believe we've had a wonderful time. On Tuesday, we had Dr. Spencer take us through stress management, take us through how to deal with low self-esteem, conflict resolution. That evening, we had Mama Francisca ministering to us. On Wednesday morning, we had a lady who had been with Labadi Beach Hotel for 20 years take us through hospitality, how to make a bed, how to make a table. And that evening, we had Reverend Mrs. Moha Salifu Amwakun take us through the evening program. Yesterday in the morning, we had a dietitianist from Police Hospital take us through the balanced diet. And in the evening, we had, Mama Rosemary Owusuentri, Prophetess Rosemary Owusuentri take us through. This morning we've had Dr. McCarthy. He was here as early as 8 a.m. He was here, and we've always had a full class. We normally have schools, institutions bring their students. It's rather unfortunate the rain, because in the had a full class. And tonight we're going to have Reverend Mrs. Mavis Annan take us through a complete woman, an agent of change. Then tomorrow morning we'll be having our breakfast meeting down there. Tomorrow morning we'll be having our breakfast meeting